Hi, good morning, Stein. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 1st of February 2024. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Stein.
And what is your candidate number, please?
My candidate number is 213333120.
Thank you. And are you taking this test as a nurse?
Yes, I'm.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you explain medications, treatments, or healthcare situations without using a lot of medical or healthcare jargon?
I recognize the diversity in patients' educational backgrounds and their familiarity with healthcare terms. Therefore, I made a conscious effort to communicate using terms that resonated with each patient. Instead of using medical terms like edema, I'd say swelling, and for hypertension, I'd use high blood pressure. Similarly, I substituted acid reflux for gastroesophageal reflux. To ensure clarity, I encouraged patients to repeat the information until it aligned with their understanding.
Describe a situation where you displayed teamwork.
In long-term care, nurses often manage various responsibilities. One day, my coworker was overwhelmed with a resident fall, a new admission, a discharge, a heavy med pass, and Medicare charting. Seeing his struggle, I offered to handle the admission and start his discharge paperwork. Grateful, he finished his tasks on time and left work without further stress.
What do you do when you don't know an answer to a patient's question or how to address a situation?
At the start of my shift, I review patient diagnoses and medications. If something is unfamiliar, I do quick research or ask more experienced colleagues for guidance. I may also contact the pharmacist for medication clarification. If I'm ever unsure, I don't guess. I seek assistance from my nursing supervisor or someone with more experience. My priority is ensuring patient care is not affected by any gaps in my knowledge.
Tell me about a time you dealt with an unhappy or difficult patient or family member.
I once dealt with a patient's family member, unhappy with the wound dressing I applied. Despite following the doctor's orders, she preferred a different dressing. I reassured her about the prescribed treatment, explained it in simple terms, and apologized for the communication gap. She thanked me for clarifying, and acknowledged she wasn't aware of the order change. I assured her of my availability for any future questions.
How do you handle changes to your assignment, the unit, schedule, etc.?
Upon the transition to electronic medical records at our facility, I adeptly and swiftly learned the new system. Recognizing that some older nurses encountered challenges adapting, I voluntarily stepped forward to assist. Subsequently, I joined a team dedicated to supporting the transition from traditional paper charting to the new electronic system for these nurses.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning Mihiraa. I'm Nurse Stein Playside, your attending nurse, here in the hospital today. I'm here to discuss postoperative care with you. Before we delve into that, how are you feeling now?
Good morning, nurse. I'm not feeling that great. I'm still in a lot of pain.
I'm sorry to hear that, Mihiraa. Can you tell me if you've noticed any changes in your pain since the surgery?
No, nurse. It's still the same.
I understand. Besides the pain, do you have any other concerns?
No, nurse. My main concern is the pain, and I'm a bit worried. I feel like this level of pain isn't normal.
Mihiraa, I acknowledge your concerns, and I want to assure you that the pain you're currently feeling is a normal aspect of the healing process, post-surgery. Experiencing some discomfort is quite common as your body goes through this recovery phase. Keep in mind that this discomfort is temporary, especially considering it's just the second day since your surgery. As your condition improves, the pain will naturally diminish. It's a normal part of the healing journey, so try not to worry too much. It's entirely expected. By the way, Mihiraa, have you engaged in any physical activity today?
No, nurse. I haven't done any physical activity. I haven't even gotten out of bed, because I'm afraid it will make the pain worse.
It's completely normal to feel so, Mihiraa. However, you're now free to start incorporating some gentle physical activities. It's crucial for your recovery. Mihiraa, physical activity plays a significant role in your recovery. It helps alleviate pain, aids in healing, improves blood flow, and reduces the risk of blood clots. So, I recommend you to start with gentle activities, like walking, which is beneficial.
Definitely, nurse. That sounds helpful.
Now, Mihiraa, let's discuss the next steps in your recovery. We'll be removing the IV line and catheter, and then closely monitoring to ensure your bladder function is restored. If you can pass urine within 3 to 4 hours after the catheter removal, we can talk about the possibility of your discharge. Do you have any questions or concerns about these steps?
Yes, nurse. I don't want to withdraw the IV line, because I'm afraid the pain will be too much.
I genuinely understand your concern, Mihiraa. Nevertheless, continuing the use of IV morphine beyond the initial recovery period can have adverse effects on your health, leading to dependency and reduced mobility. Withdrawal from IV morphine is crucial for your well-being, as it helps minimize the risks of constipation, nausea, vomiting, and drowsiness, factors that could hinder your recovery. Rest assured, we will transition to oral morphine to ensure effective pain management during your recovery process.
I'll try to do some exercises, but can we keep the IV morphine to ensure the pain is under control?
It's essential to transition to oral medication. You'll now transition from IV to oral morphine with a carefully reviewed dosage. As your condition improves, we'll gradually replace morphine with paracetamol. You shouldn't notice a significant difference, and it'll contribute to a smoother recovery.
Okay, I understand now. I appreciate you explaining the process. Well, what about the stitches and dressings?
Great question, Mihiraa. You have dissolvable stitches that will naturally disappear within 2 weeks, and the dressings will be removed within 3 to 4 days. This process is integral to ensuring that your recovery progresses smoothly.
Okay, nurse.
Lastly, Mihiraa, I'd like to underscore the significance of your consent in the process of removing the IV line and catheter. Your agreement is crucial, and I want to ensure that you are comfortable with this step. May I have your consent to proceed with the removal?
Okay, I think I understand everything now. I consent to you.
Great. Thank you for your cooperation, Mihiraa. Before we conclude, let's review our discussion. Initially, I acknowledge your ongoing pain, a normal aspect of postoperative healing. It's only the second day since your surgery, and the pain is expected to diminish with time. I recommend incorporating gentle physical activities, such as walking, into your routine, to facilitate the recovery process. Concerning the withdrawal of the IV line, it's a crucial step for your overall well-being. Prolonged use of IV morphine carries potential negative effects, leading us to transition to oral morphine for effective pain management during your recovery. Following this, we'll proceed with the removal of the IV line and catheter, closely monitoring your bladder function. If you can pass urine within 3 to 4 hours after catheter removal, we can explore the possibility of your discharge. Regarding your stitches and dressings, you have dissolvable stitches that will naturally disappear within 2 weeks, and the dressings will be removed within 3 to 4 days. Lastly, I appreciate your consent for the removal of the IV line and catheter. Your understanding and cooperation are integral to a smooth and successful recovery process. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.